Okay, we're going to talk about elastic wraps today. There's going to be different sizes, starting with like a 2-inch, which would be for a thumb, wrist, or hand, a small area. We're going to talk about 4-inch, which is the most common one. These are elastic, so as you pull them, you can see the give that they have. One important point when we're ever using these, for compression, we never want to pull them all the way tight. You can cut somebody's circulation off with this. So we want to pull them about 3/4 tight, 50 to 3/4 tight, right? This would be mostly used on an ankle, could be used on a knee, and then as we go up a 6-inch, we will use on a hamstring, we'll use on a knee. And then we have a double length, which we will learn in the hip for a hip spica, for a groin wrap, for hip flexor strain. But right now we're just going to do for an ankle sprain. Once again, 90% of the time it's on the lateral side, or what you might call the outside of your ankle. This is our lateral malleolus. Most of the swelling is going to be here. That person would have sprained their ankle by plantar flexing and inverting, so you see how it stresses this area. So when we are doing this, we're trying to get some compression because they have a lot of swelling. It may be even into the foot, it may be even into the toes. All right. One important thing we want to use is a horseshoe. And this horseshoe is going to go around this bone. We want to try to push the fluid out away from the ligaments, all right, and up out of the leg. So it's very important if you have a horseshoe, or you can make a horseshoe of felt or pad or anything, that is really going to help tremendously. All right. If you don't have that and you just have ACE wrap, everybody should have an ACE wrap in their first aid kit. Have it at home. It's a great thing that you can use for splinting, compression wraps, support, all kinds of things. You want them as comfortably as they can to dorsiflex their foot up. They may not be able to do it that far with the ankle sprain, but you want to comfortably get them up as high as possible. What happens if they droop their foot all night is they will not be able to bring it up in the morning. Their calf, their Achilles is going to get super tight. It's never going to hurt them to try to pull that up as much as possible. We're always going to start distally and move proximally up. You never wrap here, down. And that's easy to remember because you want to take whatever fluid you have here and compress it upwards, right? Always towards the heart. If the toes are swollen, you may include them. Normally we start right around the ball of the foot. And once again, pulling about 3/4, not too tight. Now if I'm going to have this, I can add my horseshoe in there, very important piece. Now we just want to overlap. You don't have to do anything fancy. If you want, we can do a figure 8, which helps pull her up into dorsiflexion. This is where you want the most compression, right around that ankle. And then as we move up the leg, we're going to put a little less compression. Now it has to still have some or it'll fall down. All right. This is plenty wrap for her ankle. And then we're either going to tape this in place, or you can use the little hooks to do that. A couple things you want to note is it should not be too tight. You need to explain to your patient. You don't want any purple toes. You don't want any numbness or tingling. Generally, we have them take this off when they go to bed because your circulation goes down at night and may be too tight. If it starts throbbing, always take that off. It's probably too tight. So check circulation in the toes and ask the patient too, because it should be a comfortable compression, not too tight.